Welcome to the Heart of Health and Science. Today we're going to be talking with someone who has a direct connection into how to get into nursing here in Liberty, Missouri. Before we go into that conversation, I want to remind everyone that I too am a nurse. My passion is nursing. I've been a registered nurse for greater than 30 years. And that really ages me quite a bit, I think, actually. And my passion for nursing started long ago. And it's far beyond just wanting to come into the field to help people. It goes far deeper than that for me. And when I was able to go into leadership within nursing, I really wanted to be able to bridge a gap between the nurses that are taking care of the patients at the bedside and those that are making the decisions in the corporate offices. I wanted to be a bridge between that. So I kept going back to school, so that I could learn as much as I could about the business side, about leadership, about how to continue to make nurses grow, how to make nurses and nursing flourish, how to make people want to come into the field and remain in the field. So today's podcast is going to be all about that and more. So now I'd like to introduce our guest, Leesa McBroom, who is coming to us from the William Jewell College of Nursing. So Leesa, tell us a little bit about yourself.
Well, I'm really excited to be here, Regina. Thank you.
Me too, actually.
I really didn't think I wanted to be a nurse when I was younger. Mm-hmm. My mother died from breast cancer. And so when I was not interested in being a nurse, but then like you said, you have passion and calling to take care of people. So I went back, went to school, became a nurse, moved to Kansas City from California, loved it ever since. I've been here over 24 years. So I guess I'm a native now. And I started in ICU and cath lab and decided I wanted to make a difference in people's lives more than just seeing them during their ICU stay. So I went and became a family nurse practitioner. I did that for about a year. And then education just kind of found me and I found it. And it's been a real blessing to be able to influence nurses who are going to be out in the field.
Right.
Yeah.
Right. I didn't know that. I didn't know a lot of that, actually. I didn't know about your mom. So sorry about that. I've heard so many stories about how people watched a loved one go through a chronic illness or an acute illness, and that either turned them towards nursing or as far away from it as possible. Yeah. Because it was just too personally painful. For them. I love that you were able to turn that tragedy into something that would help for future generations. I love that.
Yeah.
I also didn't realize you were a nurse practitioner.
Oh, yeah, I do practice one day a week. I think it's really important for me personally because if I'm teaching, I want to make sure my hands are in it so my students know I know what I'm doing. And, I was glad to be, part of the pandemic so I could help my students understand what was going on. So
that pandemic changed us
a lot,
didn't it? It changed the face of nursing. It changed what it looks like. The foundation and the fundamentals of nursing seems to have changed just a little bit, which brings us to, I'm just so glad that you're here with us because that pandemic, while it changed what I think changed the foundation of nursing or that fundamental of nursing, did it really? Did it change the people coming into nursing, whereas the foundation remains? And you could speak to that with your ties to William Jewell.
Yes. Well, I think initially COVID really gave nursing schools a bump initially because I think everybody heard the call and came. Yeah. I do think the students that are coming are what you said, a lot of them. We ask every student, why do you want to be a nurse? And a lot of them say exactly what you said, that I had a family member, a friend, and the nurses around them were so amazing. I wanted to be one. And that's really exciting. Right now, I think the issues that are going on in nursing come from a kind of a backlash from COVID. We've had a lot of negativity, especially on social media about how hard the job is, and not really focusing on how great the job is. It's so great to be able to walk into a patient room, help them solve a problem or help them get, better health and be able to walk out of there in a much better place. And those are the things that I think ignite all of the nurses, but that's what ignites students to be a nurse. And that's what we want to tap into.
Right.
So the skills, yes, there's all these baseline skills, and we can help them grow, especially in their critical thinking skills. Right now, I think nursing's kind of suffering because there's not enough students, not enough nurses.
Right. I just read an article yesterday that talked about the shortage of nurses and why there is such a shortage. And it's been predicted since the 80s, and then again in the 90s, and then again in the early 2000s. And here we are. We have one generation of nurses that are at their retirement time. They're staying a little bit longer, going a little early, but this is that time. And we're going to lose thousands and thousands of nurses from the workforce. And then we have a generation coming up that they practice a little bit differently. Not better, not worse, just a little differently. And that's transforming healthcare, I think, because of the way nurses are coming in and practicing. Then we have a shortage of people wanting to go into nursing. And in some parts of the country, according to this article, in some parts of the country, it's based on a shortage of instructors in nursing schools. And that had a lot of reasons associated with that. But here we have phenomenal schools. We have amazing instructors. And we have a pipeline that will allow people to go into nursing with support financially, support emotionally, support with the studying, and how to bring all of that together. So can you talk a little bit about the things that William Jewell is able to do and the things that Liberty Hospital and William Jewell are doing together?
We're doing some amazing work. And I think part of that's part of the good thing about the pandemic is that we've decided, hey, we need to make some more partnerships and figure out how we can get people through these pipelines and progress them from CNA, LPN, RN into graduate level nurse practitioner, midwife, nurse anesthetist. It's really a pipeline. Nursing is really a growth. And so one of the things that Liberty Hospital and Liberty Public Schools and William Jewell came together with was that we are offering seniors in this school district to be able to be part of what we call Collegiate Nursing Academy. And what that is the students are at William Jewell, taking courses to learn how to be the basic skills of nursing. They can become a patient care tech, the basic skills of a certified nursing assistant, those kinds of things. And then they're going to Liberty Hospital to do all their clinicals. And we have an amazing faculty member who's on both sides and really helping those students. We celebrated 21 students last year for our inaugural year. And at the end of that, those students, the ones that come to Jewell, get a scholarship for 4 years. We had 4 of them come to Jewell, which was really exciting.
Yes.
All of the other ones actually decided to go to school. I think all of them are going to be in some kind of healthcare, probably nursing. And at different levels. They're going to go to community college and come. They're going to go straight to 4-year college. They're doing different things, which is really exciting to be able to give them the opportunity and the understanding. And they can use this job to work through school if they choose to do so. Liberty Hospital also offered interviews to all of those students. And I think that there were 1 or 2 students who, out of that program, are working at Liberty Hospital now, which is really, really nice. Yeah.
We have people in our leadership roles, in our nursing leadership, that graduated from William Jewell. In fact, one of our first guests on the podcast was from William Jewell, and he talks about how much he learned. One day I was talking with him at work, this his name was Addison,
Addison,
talking with him.
yes.
And we were talking about theory, the different theorists in nursing and the different theories that they bring to the field. And he said, "Oh, you mean like," and then he rattled off a theorist and exactly what they did, what they contributed to the field. And everyone in the rooms, their head just kind of went sideways and looked at him. He goes, "I went to William Jewell. I know these things. Ask me something else," he said.
Awesome.
It was such a cool moment.
Yeah.
I thought, these William Jewell students they're really, really getting so much in their degree and in their education and their experience.
Yeah.
We have so many great schools right around this area. Can you talk just briefly about the differences as you see it between an associate's degree, a bachelor's degree in nursing, a BSN, a master's of science in nursing, and onward? There are some differences.
Right.
One of the big pushbacks that I receive from people they have an associate's degree, phenomenal nurses, and they just aren't sure that they want to go back and earn their BSN.
Yeah.
What are some things that you think are really a difference between those two? Why would they want to do that? So that was a loaded question.
Right.
Differences between associates, bachelors, and masters in nursing, and then why would they want to progress?
We've got some phenomenal ADN programs here, and we're working with a lot of them here in the city. So, and those kind of students bring so much more to the classroom when they come to the BSN level, and because they have so great of experience. Those schools really focus more on skills and learning nursing. Baccalaureate degrees, you're looking at levels that are going to be a little bit higher thinking in community thinking, learning how to take care of populations, those kinds of things. And also leadership, a big focus on leadership. Right. At the master's level, you're looking at advanced practice level, which would be nurse practitioner, midwife, nurse anesthetist. And now we're moving into doctorate levels that are also a doctorate level nurse practitioner, a doctorate level leader, and also Ph.D. for research.
There's just so much just within the field of nursing, that you can go into, these various degrees. And then once you have the first degree, you can go into so many different areas. You can be in a hospital, in a long-term care. You can be in a mental health facility. Yeah. You can be in a lawyer's office.
Yes.
You could be on a cruise ship. You can,
Sounds
fun. Be at Disney.
Yeah.
I mean, there are so many things you can do with that fundamental degree that begins with nursing.
Well, that's what I love about nursing, that especially the BSN sets really, it's a generalist degree. You're going to get peds, you're going to get OB, you're going to get mental health, which is so important.
So important.
All the basics that you need, the leadership skills, those kinds of things. And then what I love about nursing is, and I've seen this time and time again, if RN may say, I'm ready to get out of ICU, and they decide they want to go to labor and delivery, and they can do that because they have that baseline degree, the knowledge, the critical thinking skills, everything they need to move to a different specialty if they decide to do that.
The foundation is set. So Liberty Hospital and William Jewell, we do have a very unique partnership.
We do.
And we've had a lot of successes in what I consider a short amount of time that I've been part of that discussion.
I agree.
So can you talk a little bit about the program that William Jewell and Liberty Hospital are working together, in the clinical instructor and the clinical sites that we have, and then also some of the ways that people can get enrolled in the program and benefits they earn from the program.
Right. Well, we have a unique partnership with Liberty Hospital. There's not many hospitals in the area yet that are doing the clinical instructor partnership with a school. In fact, I think there may be other hospitals who are going to mimic what you've done because it's been so successful.
Yes, it really has been.
And what I appreciate about it, first off, they have two of your instructors are actually William Jewell College nursing students, so I appreciate that. But the fact that these nursing students or nursing instructors are in a hospital in the culture. They know the people, they know how the system works, and then they can bring in the students and give them such a much more robust experience. And that's been really helpful, I think, for all of our students. Another thing that Liberty Hospital and Jewell is doing is an accelerated track process, scholarship. So you can go the traditional route, you can go the transfer route, which that's easy progression. But there's also a lot of people out there who may have wanted to be nurses when they went to school the first time, or they're out there and they're thinking, hey, I want to do something more. I want to give back. I want to care for people more than what I'm doing now. So we've got a track called Accelerated Track, and that's a student who's had a bachelor's degree in something else, been in another field, and they've decided to come back to school to be a nurse. And I mean, I'm telling you, we've had retired nurses, we've had exercise physiologists, biologists, vets. I mean, we've had a variety. Wow. Yeah, amazing. And they bring such robust and rich conversations, not only to the classroom, but also, I think, to nursing. What Liberty Hospital has done is worked with us on a partnership. Our accelerated track is a 12-month program. So bachelor's degree, 12 months in nurse, very successful. We've had 100% pass rate 2 years in a row.
That's wonderful.
Yeah.
Wonderful.
Just to brag about our students. Yeah. To think, can I be a nurse in 12 months? Absolutely, you can. You absolutely can. And what Liberty Hospital's done is partnership with us to where we're giving a scholarship, and then you'll be able to do a lot of your clinicals at Liberty Hospital, kind of getting you prepped, and then you'll work for Liberty, and then the scholarship that you have to set in really cuts the tuition almost, like half to 3/4, somewhere in there. And I think that's really important in this day and age, that we try to figure out how to help students pay for this exceptional education.
Yeah. There are different ways that organizations are trying to speak to the cost of returning to school or going to school for the first time, and earning a nursing degree.
Yeah.
I had worked at a hospital that had a program that was a loan forgiveness program that for every 3 years they worked, they would pay X amount of dollars towards their loan. And which was great, it was great. But that didn't encourage people to come into the field because the cost was still a deterrent at the beginning. So I really like the way we've been able to do that here is that we're helping offset the cost at the beginning. So it's not a hardship on people and, in their life and their livelihood and their families. It's not so much of a hardship because the help is at the beginning.
Yeah.
And then a guaranteed job is at the end.
Yes.
That's amazing. How many people can go into a college or university setting to earn a degree, wondering what they're going to do? Are they going to be able to find a job when they complete that?
Yeah.
But not here, not with this program.
Yeah.
When they go through the program, they know they have a job. And they've done their clinical time there. They've already spent time in the hospital. So it's not like going to a place for the very first time. It's just returning.
Right.
In a different capacity.
Yeah. And what's great about it is that you're able to offer the students to go into any kind of field they want. I mean, our students are going into OB, ER, ICU, med-surg, ortho. Surgery. Yeah. And that's a big need. Surgery is.
Yes, it is.
So, that's very unique. When I was in school, I didn't have a job when I graduated. Well, I did, but it took a lot of work, and I wasn't going to have it where I wanted it. But I came to Kansas City and got it in ICU. But the market is so great, and the opportunities are just amazing right now.
Yeah, they really are. They really are. When I went to school, I lived in West Virginia and went to school at West Virginia University. Go Mountaineers. And then I married the military. And the day after graduation, moved to South Dakota. I didn't know anyone in South Dakota. I hadn't taken boards yet. So I left school, moved, and then I had to find the location where boards were, where I could sit to take boards. I did it in the day that it took 2 days pen and paper, and you had to circle in the little dots. None of this computer stuff, and within hours if you passed or not. I had to wait weeks to know if I passed or not. It's just a different time. I didn't come out of school with a guaranteed job. Of course, I moved. That was different, but I had to really search.
Yeah.
And at that time, the shortage wasn't as severe as it is now.
Yeah.
So, it was a different time. It's a perfect time to go into nursing. If there's anything in someone that makes them think, I'd like to look into it, now's the time.
Absolutely. And I would encourage anybody who is actually a nursing admissions person, we have a nursing student liaison. And even those students, right now we're working on a program with Liberty Public Schools that's going to be early college with direct entry into nursing. Mm-hmm. And so they're going to do all their prereqs. They can, and the state of Missouri is amazing because they're paying for 2 years of college while you're in high school right now. So if a student finishes their 2-year degree, they can start nursing school the first year of college. Can you believe that? And then if they just get the prereqs, they just have 1 more year, so they can be done in 3 years. And I think we've got to really work hard together as partners and look at this workforce and figure out how we can drop down some of these barriers, silos, preconceived notions, and let those go so that we can bring more people into nursing because it changes lives.
It does.
Yeah.
So many lives.
It does.
I was meeting with someone yesterday, actually, and we were talking about nursing and the impact of nursing. And I said, at one point I sat down and did the math. And for every nurse that takes care of just 5 patients during their shift, if they work 72 hours a pay period, and they take care of 5 patients a day for 3 days a week, 3 12s a week, that's 15 patients that they're taking care of, minimum.
Yeah.
And then there's the family that witnesses it, the visitors that witness it, then all the people that they tell and encourage to come in and have the same experience should they need something done, for healthcare. Yeah. And if you do the math very simplistically, you are reaching thousands of people a year. Yeah. By coming to work and taking care of the people that are assigned to your care. It's remarkable the stretch and the outreach that a nurse has.
Well, not only that, but like nurse educators, you're influencing all those students.
Yes.
And then those students are going out. And then as a CNO too, you're influencing all the families, all the patients in our community.
Yeah.
Fold after fold after fold.
Yeah. I take it very seriously that every decision that I make in this role is incredibly important and it will ultimately impact lives.
Yes.
Yeah. And that's not to be taken lightly at all. Yeah. So I now want to bring us to our final question for you of the day.
Okay.
And it's my favorite question of our podcasting.
Oh.
And that is, could you share with us your favorite story that highlights your experience in nursing education? Your favorite story.
Oh, dear. Well, I've been in education for 21 years. So that one favorite story would be hard. I think
there's so many.
I think the biggest, there's probably 2 things that really excite me. And that is when I'm at pinning and I see siblings come back to pin their other sibling. Yeah. We had a sister who came to our accelerated track. Then her brother came, and then her second brother came to the traditional track. I enjoyed him because he skateboarded all over the campus, and so I kind of missed that. But to see those 2 pin him was really amazing. And we've got story after story of mom, grandmother pinning their daughter. But the biggest thing that makes me excited and passionate about this is that I see single parents, moms and dads, who have kids at home who are trying to make a better life for themselves. And that really makes a difference.
And what I just saw happen was the heart of a nurse just coming out right there. Yeah. That I love that. I love that. How can you not want to go into healthcare after hearing these kind of stories and the family difference that's being made? Mm-hmm. It's moving. It's truly moving. So I want to thank you, Leesa, for coming, sharing some of your knowledge with us, your experience with us, and helping encourage people to go into healthcare and into nursing specifically today. So thank you so much.
You're welcome. Thank you for having me.
And thank you for joining us today and watching our podcast of the Heart of Health and Science. If you're considering a career in healthcare, a career in nursing, just reach out to Liberty Hospital and we will connect you. Until next time.